Hey there, Mike Wessel from MotionWorks Physical Therapy. So, just continuing with the theme this week of a couple of quick tips for running, as it is spring and it is getting to be some nice weather out there. So a lot of people are going to start getting outside and getting on the roads. So a lot of patients will ask me about what's the best type of running shoe that they should be wearing, and that's really just too broad of a topic for one of these 1 or 2 minute videos. But I will say that a lot of patients do come in with what look like really old, worn out running shoes that they've been wearing for a long time. So I just thought I would just breach the topic of how often should you be replacing your running shoes. Most running shoes are going to have a lightweight foam in it called EVA foam, and that foam will lose its ability to absorb impact over time, and most research will show that it loses its ability to absorb impact somewhere between 300 to 500 miles or every 5 to 6 months. So as it loses its ability to absorb impact, your risk of injury increases. So replace those running shoes, all right? Again, every 300 to 500 miles or every 5 to 6 months, and that will hopefully help reduce your risk for injury, all right? So again, I'm Mike Wessel from MotionWorks Physical Therapy, and hope that's helpful. Thank you.